Hey guys, in this chapter of stress and adaptation, we're going to learn how the body and mind respond to stress and how coping works and how the impact stress has on both patients and nurses. At the end of this PowerPoint, you should be able to identify some of these key concepts related to stress and the effects it has on health. So what exactly is stress? Stress can be defined as any disturbance in a person's normal balanced state. Remember, every person's response is different to the stressors. Stress can be harmful, leading to illness, but it can also be motivating. A stressor is a stimulus that a person perceives as a challenge or threat and disturbs the person's equilibrium. So on this slide, we have different types of stressors. We have physiological, which are stressors that can affect the body structure or function. These can be chemicals such as poisons, medications, tobacco. Physical or mechanical, that means trauma, cold, maybe joint overuse. Nutritional, which is vitamin deficiency, maybe a high-fat diet. Infectious agents such as viruses, bacteria. Hypoxia, genetic, inborn errors of metabolism and lifestyle, which can be obesity or a sedentary lifestyle. Psychological are external stressors that have arisen from work, family dynamics, living situations, social relationships, and other aspects of everyday lives. So what is adaptation? Adaptation means adjusting to the stressor in a way that allows growth, development, and effective coping. Whether or not someone adapts well depends on the stressor's intensity, their coping skills, and personal factors like age, health, and support systems. When a person is threatened or otherwise in a stressful situation, immediate responses occur. Those responses, which are often involuntary, are called coping responses. The change that takes place as a result of the response to a stressor is referred to adaptation. Successful adaptation allows for normal growth and development and responses to change and challenges in everyday life. The outcome depends on the balance between the strength of the stressors and the effectiveness of a person's coping mechanisms or methods. Even with a positive attitude and good coping skills, excessive amounts of stress can lead to maladaptation and even disease. Some people succumb to illness after experiencing only a few stressors, where others seem to adapt to multiple intensely difficult stressors. Each person has a different ability to tolerate stress, but everyone has a breaking point at which stress becomes overwhelming. Our bodies are constantly working to maintain a balance or homeostasis. The autonomic nervous system and endocrine system also do most of the work, but other systems like your respiratory, cardio, and GI are also involved. This process is self-regulating and happens without conscious thought. Autonomic nervous system and the endocrine system primarily control that homeostatic mechanisms. Local adaptation syndrome, or also known as LAS, is a localized response of the body to stress. It usually involves one specific body part. Most common that we as nurses deal with are reflex pain response, which is withdrawal of a limb from a painful stimulus, protective local reflexes, the inflammatory response, which is a local reaction to a cell injury, which means the process includes vascular response, which is the first phase of inflammatory response. Injured cells release histamine, which increases the blood flow to the area. Kinin is released by dying cells and causes fluid to move from capillaries into tissue spaces. This can cause edema. Leukocytes move into the area to fight infection. Cellular response, phagocytes go to the area, kill off or wall off the pathogens. Exudate information, the white blood cell and extra fluid ooze from the area. This is serous sanguineous fluid. Healing happens when the tissue is repaired or regenerated. All All right, general adaptation syndrome, also known as GAS. We're going to talk about that. Hans Selye described the general adaptation syndrome, which is the body's general response to stress and has 3 stages, which we'll get to. The GAS model explains a primary physiological response to stress and the local adaptation syndrome, LAS model. So the 3 stages we have is the alarm stage, which is also known as the fight or flight response. Here's when the sympathetic nervous system kicks in. You'll see an increased heart rate, increased blood pressure, bronchodilation, and increased glucose levels, and then the blood flows to the muscles. The second stage is the resistance stage. The body tries to maintain homeostasis. Coping mechanisms come into play at this point. If successful, the body returns to normal. If not, we move on to the third stage. The third stage is the exhaustion stage. If stress is prolonged and coping fails, reserves are depleted. We see low blood pressure, elevated pulse and respirations, and often development of illness. Sometimes, if the stressor is removed, recovery can be possible. Check out this figure to kind of help you understand where general adaptation syndrome looks like, and it gives you a visual of kind of how that map goes with the body. Okay guys, your GAS, your alarm stage, fight or flight. This also has 2 phases, which is shock and countershock. Phase 1, which is the shock phase, begins when the cerebral cortex first perceives a stressor and sends out a message to activate the endocrine and sympathetic nervous systems. Epinephrine, also known as adrenaline, and various other hormones prepare the body for fight or flight. The shock phase does not last long, usually less than 24 hours, and can sometimes only be a few minutes. Phase 2, which is your countershock phase, all the changes produced in the shock phase are reversed and the person becomes less able to deal with the immediate threat. In the alarm stage, you have all kinds of involuntary body responses. An example would be like getting chased by a grizzly bear. The endocrine system. Your hypothalamus releases corticotropin-releasing hormones, which is known as CRH. CRH, together with messages from the cerebral cortex, directs to the pituitary gland to release adrenocorticopic hormones, known as ACTH, and antidiuretic hormone, which is ADH. ACTH stimulates the adrenal cortex to produce and secrete glucocorticoids, especially cortisol, and mineralocorticoids, especially aldosterone. Cortisol in general has a glucose-sparing effect. This increases the use of fats and proteins for energy and conserves glucose for the use by the brain. Cortisol also has an anti-inflammatory effect. Aldosterone promotes fluid retention by causing the kidneys to reabsorb more sodium. This way, it helps to increase fluid volume and maintain or increase blood pressure. ADH also promotes fluid retention by increasing the reabsorption of water by the kidney tubules. Endorphins, secreted by the hypothalamus and posterior pituitary, act like opiates to produce a sense of well-being and reduce pain. Thyroid-stimulating hormone, known as TSH, is secreted by the pituitary gland to increase the efficiency of cellular metabolism and fat conversion to energy for cell and muscle needs. Sympathetic nervous system. This sends a message to the hypothalamus, which then stimulates epinephrine and norepinephrine. Your SNS also affects the following systems. Your cardiovascular system. The heart rate and contraction force increase. Your peripheral and visceral vasoconstriction increase. Blood flow to the vital organs like your brain and your lungs. Also to the muscles preparing for flight. Blood volume and blood pressure also increase, and the blood clots more readily. Your respiratory system. The bronchioles dilate, therefore increasing the depth of respiration and tidal volume. This makes oxygen available for diffusion to your muscles, brain, and cardiac cells. Your metabolic system, the metabolic rate increases. The liver converts more glycogen to glucose, glycolysis, making it available for energy, except for in the brain, the body uses less glucose for energy. The use of amino acids and mobilization of fats for energy, lipolysis, increase. Your urinary system. Blood flows to the kidneys to decrease, and they retain more sodium and water. The kidneys secrete renin, which produces an angiotensin. In turn, angiotensin constricts the arterioles and tends to increase the blood pressure. Your gastrointestinal system. Peristalsis and secretions of digestive enzymes decrease. The blood glucose level increases to fuel the energy needed for fight or flight. Your musculoskeletal system. Oh my God, I'm having a seizure. Blood vessels dilate, increasing flow of blood and thus oxygen and energy to skeletal muscles. Sorry guys, that was a mouthful. Stage 2 is also known as the resistance stage. This is the coping stage where the body tries to cope, protect itself against the stressors, and maintain homeostasis. Stabilization involves the use of physiological and psychological coping mechanisms. Body decreases the cortisol release and blood pressure begins to normalize. If the person adapts successfully or if the stress is confined to a small area, you'll go back to homeostasis. If the stress is too great, as in a serious illness or severe blood loss, your defense mechanisms fail. Then the person enters the third phase of GAS. The third stage is exhaustion or recovery stage. There are 2 ways this stage can play out. Exhaustion, stress isn't stopped and the body's adaptation mechanisms are used up. Then the patient goes into exhaustion. Physiological response in this stage include vasodilation, decreased blood pressure, and increased pulse and respirations. Think about a trauma patient who was resuscitated in the ED, then went to surgery and ended up in the ICU. After a couple of days, the patient's blood pressure drops and they have an increased heart rate and respiratory rate. Physical adapt resources and energy are depleted. The body is unable to defend itself and cannot maintain resistance against the continuing stressors. Exhaustion usually ends in injury, illness, or death. Recovery. If adaptation is successful, the final stage is recovery. So for an example, after a big trauma, if we get the bleeding stopped and are able to stop the other injuries and support the body's recovery efforts, then the patient will be able to recover. And here we have physiological homeostasis. Physiological balance is just as important. Stress can cause anxiety, fear, panic, anger, or depression. If these emotions aren't managed, they can become overwhelming and interfere with functioning. Here's an example. Every person needs to feel loved and a sense of belonging, to feel safe and secure, and to have self-esteem. When these needs are not met or a threat to the need fulfillment occurs, homeostatic measures in the form of coping or defense mechanisms help return the person to an emotional balance. There's a link between physiological stress and psychological stress. Consider some of these. Tomorrow, you're scheduled to take a final exam. You must earn a passing score to pass the course and to remain into the nursing program. After being awake most of the night, you cannot swallow any food at breakfast. You have a rapid heartbeat and you are filled with feelings of apprehension and you have diarrhea. Although the exact cause is not well understood, it is thought that humans react to threats of danger as if they were psychological threats. A person perceives a threat on an emotional level, and the body prepares itself either to resist the danger or run away from it, aka the fight or flight response. Some of these responses include anxiety, which is defined as a vague, uneasy feeling of discomfort or dread accompanied by an autonomic response. The source is often nonspecific or unknown to each individual. A feeling of apprehension is caused by anticipation of danger. An anxious person worries and feels nervous, uneasy, and fearful, maybe even tearful, and often has physical symptoms such as nausea, trembling, and sweating. Fear is an emotion or feeling of apprehension or dread from an identified danger, threat, or pain. The danger may be real or imagined. Panic causes the person to lose control and experience dread and terror. The resulting disorganized state is characterized by an increased physical activity, distorted perception of events, and loss of rational thought. Panic is manifested by difficulty communicating verbally, agitation, trembling, poor motor control, sensory changes, sweating, tachycardia, hyperventilation, dyspnea, I can't talk, palpitations, and maybe even a choking sensation, and sensations of chest pain or pressure. The person is unable to learn, concentrate only on the present situation, and often experience feelings of impending doom. This level of anxiety can lead the body to exhaustion and even possibly death. Factors that influence adaptation. Also, your overall health status. Stressors may actually cause a healthy person to engage in constructive adaptive behaviors that improve health. A person who's just discovered that they have hypertension may react by modifying their diet and exercising to help lower blood pressure to prevent complications. On the other hand, if a person with hypertension also has been coping for years with pain and immobility from arthritis, he may be too overwhelmed and exhausted to take any actions to lower his blood pressure. Now we have the support system. So a good support system can help a person adapt to stress, provide emotional support, encourage expression of feelings, and help the person solve problems. It may also provide financial and other concrete types of support, such as a place to live, meals, household help, child care, and even transportation. Hardiness. People who thrive despite overwhelming stressors tend to have a quality that has been termed hardiness. They maintain 3 key attitudes that help them weather adversity: commitment, control, and challenge. Commitment lets them seek to be involved with ongoing events rather than feeling isolated. Control enables them to struggle and try to influence outcomes instead of becoming passive and feeling powerless. Challenge allows them to perceive stressful situations or changes as opportunities for learning. Personal factors such as age, your developmental level, and life experiences help learn with coping methods that have worked or haven't worked. These all affect a person's response to stress. Coping mechanisms. These are automatic behaviors to reduce stress. Anxiety is often managed without conscious thought by coping mechanisms, which are behaviors used to decrease stress and anxiety. Many coping behaviors are learned based on a person's family, past experiences, sociocultural influences, and expectations. Some of these examples are crying, laughing, sleeping, cursing, physical activity, exercise, taking deep breaths. People practice mindfulness and centering exercises, verbally debriefing with another person, journaling, engage in enjoyable activities such as distraction, which is smoking, drinking, lack of eye contact, ignoring the stressor, withdrawal, limiting relationships to those with similar values and interests. Other unconscious reactions to stressors are called defense mechanisms, which these often occur. These mechanisms protect a person's self-esteem and are useful in mild to moderate anxiety. When extreme, however, they distort reality and create problems with relationships. At that point, the mechanisms become maladaptive instead of adaptive. Adaptive are like healthy choices, problem solving, and lifestyle change. Maladaptive is unhealthy, temporary, maybe substance abuse or overeating. Those are just a few, but please take a look at the table in your book and make sure you're grasping that idea. Also, rationalization, use of logical sounding excuses to cover up or justify true ideas, actions, or feelings. An example, it was God's will. I'd be a better wife if I didn't have to work. Denial, transforming reality by refusing to acknowledge thoughts, feelings, or even desires. Unconscious, which means not consciously lying. The first defense learned, a person with like alcohol abuse states, I can quit anytime I want to. Displacement, kicking the dog, transferring emotions from the original situation to a substitute or inappropriate person that is less powerful or threatening, such as blame on the nurse, hospital, spouse. Disassociation, which is painful events, are separated from the conscious mind. An example, a person who was sexually abused as a child describes those events as if they happened to her sibling instead of her herself. Reaction formation, this is where a person is aware of their feelings but acts in ways opposite to what they say they are feeling, such as, oh, it's okay, you forgot my birthday, when in reality, it is not okay. Repression or unconscious burying or forgetting of painful thoughts, feelings, memories, or pushing them from a conscious to an unconscious level. If it's a step deeper than denial, it submerges painful thoughts. So, an example, a person doesn't remember the events of the night his wife had a heart attack and passed away at a local restaurant. So, coping styles. We've kind of already gone over adaptive and maladaptive, but let's just take this into consideration. A person is threatening or otherwise a stressful situation. Immediate response occurs. Those responses, which are often involuntary, are called coping responses. The change that takes place as a result of the response to a stressor is referred to adaptation. Like we said, adaptation is some degree of an ongoing process that a person strives to maintain a balance in the internal and external environments. Coping mechanisms or strategies are behaviors and techniques that we use to manage stressors, like our adaptive, which are healthy choices, and our maladaptive, which are unhealthy choices or temporary fixes. So the effects of stress. We're going to talk about short-term and long-term stress and crises. Stresses in a healthy person may promote health and prevent illness. For an example, fear of developing lung cancer may motivate a person to stop smoking, or anxiety about baby care may prompt a prospective parent to attend a prenatal class and read childcare books. The effects of stress on a sick or injured person are, in contrast, usually negative. Stress can make illnesses worse, and illnesses can cause stress. The presence of an illness or disability demands new coping skills at the time when homeostasis is challenged. So long-term stress poses a serious threat to the physical and emotional health. As the duration, intensity, or number of stressors increases, a person's ability to adapt is lessened. Higher levels of stress, ongoing stress, are associated with multiple health disorders, such as alcoholism, drug abuse, depression, suicide, accidents, eating disorders, have all been associated with chronic stress. Stress alone does not cause an autoimmune disease, such as RA, rheumatoid arthritis, but is believed to contribute to the progression of those illnesses. Researchers have confirmed that chronic stresses affect the ability of the immune cells to respond to the hormones that normally regulate inflammation, thus allowing the development and progression of some diseases. Stress has a negative effect on the entire body, such as the cardiovascular system, respiratory, your skeletal, endocrine, GI, and even nervous. Also, reproductive systems fall in that. See figure 43-3. Under normal circumstances, cortisol, an anti-inflammatory hormone, is released by the adrenal glands. This regulates the inflammatory process, but prolonged stress may decrease the effectiveness of cortisol, or the immune cells may be resistant to its effects. A person who reacts to stress by overeating or smoking, using alcohol or drugs, may become hyperactive and then puts additional strain on the body. A crisis, which is a disturbance caused by a precipitating event such as perceived loss, a threat of loss, or a challenge that is interpreted as a threat to life itself. In a crisis, the person's usual methods of coping are ineffective. This failure produces high levels of anxiety, disorganized behavior, and an inability to function adequately. As the crisis continues, the person tries new methods of coping or redefines the threat. This may lead to resolution of the crisis or if not ineffective, may result into severe panic levels of anxiety. Crisis could be the loss of a loved one, a natural disaster, an active shooter, or, as we all like to know, the pandemic. Ensuring safety of a patient and the nurse in a crisis is the number one priority here. So, our assessment. Areas to assess include stressors, risk factors, coping, and adaptation. So data about your patient's stressors and risk factors should help you to determine whether or not the patient has a realistic or an exaggerated perception of said stressor. Identify factors that increase risk for future stress. Identify interventions to reduce your current stress level and to provide anticipated guidance to prevent future stress. Responses to stress are holistic. Therefore, you will need to assess your physiological, emotional, behavioral, and cognitive indicators of stress. Support systems. Recall patients' support systems such as their family, friends, co-workers. These are all important to success of the patient's coping strategy. Conversely, these people may be affected by the same stressors or by the client's response to them. Your physical assessment, there are no specific guidelines for this, for the physical assessment of stress. Physical indicators of stress can include, but are not limited to, cardiac dysrhythmias, chest pain, headaches, hyperventilation, diarrhea, tense muscles, skin lesions, and eczema, which falls in that skin lesion category. Subjective data such as heart palpitations, difficulty breathing, problems with appetite or sleep, feelings of sadness, apprehension, anger, mistrust, helplessness, hopelessness, changes in the sexual desire. Objective data, dry mouth, increased perspiration, tremors, tachycardia, increased blood pressure, dilated pupils, possibly crying, restless, rapid speech, pacing around the room, or even a lack of facial expression. Here we are at diagnosis. So stress as the problem, stress overloads related to like single parenthood, inadequate economic resources, chronic mental illness, moral distress, cultural conflicts can all be related. End-of-life decisions, conflicting information about ethical decision-making or treatment decisions. Stress as the etiology. Stress and anxiety may affect many other areas of the human functioning, such as the following problems. Stress and anxiety are involved in the etiology of other problems. Caregiver stress related to the long-term stress of caring for a patient with like dementia, as evidenced by the statement. Such as, I'm at my wit's end trying to keep mom safe. Impaired spiritual status related to the stress of a new terminal diagnosis as evidenced by the statement, God has forsaken me. Hopelessness related to presence of debilitating physical injuries as evidenced by statement, I give up, it's just not worth it. Apathy, visible lack of engagement are all signs. Here we have a SMART goal. So planning as a SMART goal. So our statement is the patient will decrease the level of anxiety by verbalizing feelings using support systems by targeted date. So we're going to develop effective methods of coping through problem-solving skills and anxiety-reducing techniques by said target date. Also describe a reduction in anxiety and increase in comfort. Identify 3 concrete stress reduction techniques that are of interest. Identify resources to manage moral distress and spiritual distress by said target date. Your implementation stage is based on your outcomes. So, adequate nutrition is essential to maintain the integrity of the immune system and proteins are needed for tissue rebuilding and healing. So, in addition, overweight and malnutrition are stressors that may lead to illnesses. Some people may limit intake of sugar to avoid highs and crashes, and salt to avoid the rise in blood pressure or retaining fluid. Sorry, I couldn't think of there. Regular exercise promotes physical homeostasis by improving muscle tone and controlling weight. This also improves the function of the heart and the lungs and reduces the risk of cardiovascular disease. Exercise also improves emotional homeostasis by promoting relaxation and reducing tension. During the exercise, the brain releases endogenous opioids, are also known as endorphins, which create a feeling of well-being. Sleep. So rest has to restore your energy levels and allow the body to repair itself and promote mental relaxation. Most people need 7 to 8 hours of sleep a day or night. However, the amount of sleep varies among everybody. Stress, pain, illness, these may all interfere with the ability to sleep. So some patients may need help identifying and implementing techniques for relaxing to go to sleep. Relieving anxiety, because anxiety is the common response to an illness. Medical tests, treatments, you will use anxiety relief interventions every day of your professional life. Anger management. Anger is the most common response to stress. Clients usually do not openly say, "I am angry." In fact, they may not even recognize that they are angry. Instead, they engage in angry behaviors like they become hypocritical of family members or caregivers. They become verbally abusive or become extremely demanding. Stress management techniques like relaxation, meditation, visualization, biofeedback, acupuncture, or even chiropractic adjustments, touch therapies, massage therapy, and also reflexology. So change of a perception of self. So you're going to cognitive restructure here. You're going to help your patient to recognize their negative focus and restructure their thinking in a more positive and realistic way. So an example, you might encourage a working mother with a demanding family member to take a single positive step, such as saying no to someone at least once a day. Positive self-talk is another method for increasing self-esteem. Each time you hear negative self-talk, stop. Ask the patient if to rephrase the statement so that it's positive. So evaluation, we're going to check coping effectiveness. The evaluation of the plan of care is based on the mutually established expected outcomes. Be sure to observe both verbal and nonverbal cues when evaluating the usefulness of said plan. So crisis intervention, or the safer model. Crisis is a situation that cannot be resolved by usual coping mechanisms. As a result, a person cannot function normally and requires interventions to regain equilibrium. Crisis intervention is a short-term management technique focused on reducing damage to an individual or group affected by a crisis, often a mental or medical health emergency. Here we have the safer model. So this is going to be stabilization. Introduce yourself and establish your role and that of the other people involved. Meet basic needs, consider safety of all parties, and mitigate any acute stressors if possible. Acknowledgement. We're going to acknowledge the precipitating event and the reactions of the individual. Facilitation of understanding. Paraphrase and reflect back to the individual what they are experiencing. We're going to normalize the reaction to a stressful event and work to minimize feelings of personal weakness. We're going to encourage effective coping, tap into their existing coping tools and resources, and identify external sources of support to facilitate coping. Recovery. We're going to assess and establish the person's ability to function safely, and also referral. Make referrals as you need to. So, stress in nursing. Nursing is a very demanding profession. one that the U.S. Department of Labor identifies as a hazardous occupation because of the numbers of nurses who miss work days due to occupational injuries or illnesses. As you begin your clinical practice, remember that while the ANA, Code of Ethics for Nurses, remind us that our primary duty is to the patient, it also reminds us that us, the nurses, owe the same duties to self as others, including the responsibility to promote health and safety, preserve wholeness of character, integrity, maintain competence, and continue personal and professional growth. The ANA defines a healthy nurse as one who actively focuses on creating and maintaining a balance of synergy of physical, intellectual, emotional, social, spiritual, personal, and professional well-being. This leads us to self-care. So, resilience as an individual's aptitude for overcoming an adverse life circumstance with hopeful attitude, utilizing a healthy internal coping mechanism, and utilizing external resources such as a supportive work environment, mindfulness-based stress reduction training, and assertive communication skills training. Relationships with self and others, exercise, so we're taking care of the mind and the body and the spirit, soul, to remain compassionate and give emotional care, transformative thinking, leading, and thoughtful action. Be aware and reflective. Pay attention to what your body's telling you. Cultivate a type of support in your relationships that you can lean into for support and learn about and utilize the resources you need. As you move through the next chapters in this text, you'll find appropriate self-care alerts and promoting health boxes. Remember, we cannot give what we don't have. Also, you've heard, you cannot pour from an empty cup. If our own basic needs are not met, we will not be able to identify and meet the needs of the patients, their families, or even the communities we serve. So let's test your knowledge a little bit. The nurse should assess every client to determine if stress reduction interventions should be a part of the plan of care. The rationale for this action is that, I'm going to give you a few minutes to kind of think about this. The answer is C. The occurrence of stress in clients is unpredictable. If you got it right, congratulations.